Hello, and welcome to today's Lunch and Learn, Mind Over Mammogram. I'm Dr. Steve Reinches, the President and CEO of North Kansas City Hospital and Meritas Health. Thank you for joining us. October is Breast Cancer Awareness Month, an annual campaign to raise awareness about the impact of breast cancer. This breast cancer is the second most common cancer among U.S. women, and early detection offers a better chance of survival. Please put your mind at ease with our expert speaker today, Dr. Chris Formen. A radiologist, he will debunk the myths about mammogram and breast cancer myths, as well as describe the risk factors and benefits of various imaging. Dr. Formen earned his medical degree from the University of Iowa School of Medicine. He's board certified in diagnostic radiology and specializes in CT, mammography, nuclear medicine, sonography, MRI, and interventional radiology. If you have any questions about our topics today, submit your question using the Q&A feature below. We will respond at the end of the presentation. And now, please join me in welcoming Dr. Formen.
Thank you very much, Steve. Okay, so today's talk is called Mind Over Mammogram. So let's just go ahead and get started here. Does this look familiar? National Mammogram Day. Kind of obvious why we ask if you've had a mammogram. So what is cancer? Let's start with that. Cancer is a name given to a collection of related diseases. In all types of cancer, some of the body cells begin to divide without stopping and spread into the surrounding tissues. We call that metastasis when that happens. Cancer can start almost anywhere, as the human body is made up of trillions of cells. Besides skin cancer, breast cancer is one of the most commonly diagnosed cancers amongst American women. It's the second leading cause of death next to lung cancer. This year, under 30% of newly diagnosed cancers in women will be breast cancers. About 1 in 8 U.S. women, 12%, will develop invasive breast cancer over the course of her lifetime. There are an estimated 288,000 new cases of invasive breast cancer that will be diagnosed this year in the U.S. There are also 51,000 cases of non-invasive breast cancer. Those numbers are huge. Fortunately, breast cancer rates have gone down since the 80s. And so about 43 women will be expected to unfortunately pass away from this disease in 2022. For women in the US, breast cancer death rates are higher than those for any other cancer, again, excluding lung cancer. In 2022, you have about 3.8 million women who are living with a history of breast cancer in the US. So why do we get breast cancer? What are the risk factors? Most of the important risk factors of breast cancer are beyond your control. You can't control your age, your family history, breast density, or your medical history. Those things are related to our genes, and what you get is what you get. However, there are some risk factors you can control, such as weight. Along with that, of course, goes diet, physical activity, and alcohol consumption. So let's talk about those things. So first of all, being overweight is associated with an increased risk of breast cancer, especially for women after menopause. The reason is that your body's source of estrogen after menopause is usually fat tissue. Having more fat tissue means you have higher estrogen levels, and that can be associated with breast cancer risk. So diet, we always talk about diet. There's always a new diet. Well, the Women's Health Initiative has suggested that a diet very low in fat may reduce the risk of breast cancer. Now, having said that, any diet will reduce the risk of breast cancer. You can do paleo, you can do keto, you can do intermittent fasting. I mean, the bottom line is controlling your weight and your fat levels is going to be important for your general health, and not just with breast cancer, but essentially with all things in medicine. Being at a low weight is healthy for everyone. So again, you want to keep your body weight in a healthy range for your height and frame. I mean, we don't have to get ridiculous with this. And of course, some people can go the other way as well, but just a healthy weight. Body mass index, it's not perfect, but that's another way to estimate where you are on that scale. So the American Cancer Society recommends that you exercise about 45 to 60 minutes, 5 days or more a week. That sounds like a lot, but really, I mean, exercise can be anything. You don't have to necessarily go to a gym and get crazy with, cycling classes and all that, just getting out and moving, getting out and walking, particularly on a nice day. That's one of the easy ways to do that. So alcohol consumption. Studies have shown that breast cancer risk increases with the amount of alcohol a woman drinks. Alcohol can limit your liver's ability to control blood levels of the hormone estrogen. There's that word again, which can increase risk. Now, that's not to say, of course, you can't drink. I mean, all things in moderation. Everybody loves a glass of wine with dinner, but just going overboard can really do some bad things for your health besides the obvious things that we know. So smoking is associated with a small risk and increased risk of breast cancer as well. Age. So these are uncontrollable risk factors. You can't control your gender. You can't control your age. Simply growing older is the second biggest risk factor for breast cancer. Your family history. If you have a first-degree relative, a mother, a daughter, a sister who's had breast cancer, or you have multiple relatives affected by breast or ovarian cancer, those things all contribute to an increased risk of breast cancer. So also, if you have been diagnosed with breast cancer, this seems unfair, but just being diagnosed with breast cancer increases your risk of getting cancer again. Breast density is another factor you can't control. It may increase your risk of breast cancer by 1 to 2%. So along with that family history, we have our BRCA genes. About 5 to 10% of breast cancers can be linked to mutations in this particular gene. It's usually inherited from one's mother or father. Mutations of both BRCA1 and 2 are the most common. So there's also an increased risk of ovarian cancer with this. And, men can even be affected by this. So this is one of those cases where you have the gene, we basically decrease the age at which you start screening, and we screen you more often. Okay, so does this slide look familiar to anyone? Do you have to psych yourself up to get your mammogram? So oftentimes that involves mentally prepping yourself for, the struggles and the trauma that is mammography. Having said that, we try to make that process as easy for you as we can. So what is a mammogram? This is kind of nuts and bolts. A mammogram is an X-ray of the breast. Mammograms are used to check for breast cancer in women who have no signs or symptoms of the disease. That's what makes it a screening test. You don't have a disease, we're just checking it out and seeing if there's anything there. So screening mammograms usually have 2 images that we obtain. These are the MLO views. We obtain one of each breast, and then we obtain a second set of images as well. These images make it possible to detect tumors that cannot be felt. I mean, by the time you can feel a tumor, it's divided millions and millions of times. So we want to catch these things as early as possible. And one of the signs that you may have a breast cancer are microcalcifications. They're tiny deposits of calcium, and they can sometimes indicate the presence of breast cancer. So there's another type of mammogram called a diagnostic mammogram. This checks for breast cancer after a lump has been found. Besides a lump, signs of breast cancer can include breast pain, thickening of the skin, nipple discharge, or change in breast size or shape. Nobody knows your body as well as you do. So, looking for these things on your own and with conjunction with your doctor is probably the best way to go about this. Diagnostic mammograms are also used to evaluate changes found during a screening mammogram. So I do the mammogram, I see something abnormal on it, so we go back and we get some more tests. And they're also helpful when you have breast implants. That's another reason to get a diagnostic mammogram. So what is a 3D mammogram? That's something that we've had at North Kansas City for some time now. It takes multiple images of the entire breast. A conventional mammogram produces one image of overlapping tissue, which makes it somewhat difficult to see things that are hidden because you have to get through all the tissues to see it. A 3D mammogram allows you to essentially slice the breast into individual sections. So it's kind of like finding the proverbial needle in the haystack. It's a lot easier to do if you can go bit by bit and look from all angles. So some of the benefits of a 3D mammogram over a 2D mammogram, you have increased detection rates, about 40%, reduced false positive rates. So those are people that we think have cancer, but they really don't. We reduce those people by 15%. We also cause a decrease in callbacks. for diagnostic mammograms, which of course, every time you see something, you call a patient back, there's some anxiety associated with that can be a little unnerving. Other benefits: earlier detection of small breast cancers, greater accuracy in pinpointing size, shape, and location, fewer unnecessary biopsies. In medical school, we take the oath to do no harm. So we don't want to do unnecessary biopsies. Greater likelihood in detecting multiple breast tumors with 3D mammography. So another issue that we commonly face is breast density. Again, this is one of those uncontrollable factors that you're born with. So we grade these densities 1, 2, 3, and 4, 1 being the least dense, 4 being the most dense. Only about 10% of women have a category 1 breast. So to illustrate this, you can see going from left to right, that's the left breast is a breast that has less density, less of the white kind of infiltrating stuff that you see. And as you progress to the right on the screen, you see that portion gets more and more significant. And so the densest breast just has a lot more going on, a lot more tissue, and those are hard to see through. So that's one of the reasons that our 3D mammograms work so well. So automated breast ultrasound. This is a further way that we can examine those breasts that are really dense. And it basically does the same thing, but this time it uses ultrasound to look at the breast as opposed to ionizing radiation. So ultrasound is going to be safer in that regard because you don't get a radiation dose. It's just sound waves. But you can kind of do the same thing with automated breast ultrasound. So that allows us to have a second modality to look at those really dense breasts. This is kind of what it looks like. Simple procedure with minimal compression. We do a fair number of those. Okay, so just to close, we have a full service state-of-the-art imaging center here at North Kansas City. I'm in there quite often. It's very nice. We offer 2D mammograms, of course, 3D mammograms, and like we've talked about, ABUS and breast sonography. We also do breast MRI and stereotactic breast biopsy. So if we see some abnormality that we're not sure about and something that looks like it could be ominous and cancer, then we can go ahead and get you your biopsy here. So it's kind of a one-stop shop. We also perform OB-GYN procedures with sonography. So we really kind of cover all issues in women's health here at North Kansas City. So if women controlled medicine, I don't know, maybe this would be a thing. Seems fair, right? Okay, thank you very much.
That was fascinating. So I learned more today about mammography than I had ever known in my medical career. Who makes the decision about whether you get a 2D mammogram or a 3D mammogram?
That's a very good question. So at this point, most insurance companies are paying for 3D mammograms. So as long as the patient is okay with it, there really are very few downsides. As I've said, it's a better exam. You can get more information. You can detect cancer more efficiently. And so at this point, it's kind of up to the patient. It's covered by almost all insurances. So if the patient's okay with it, we try to do a 3D mammogram if possible.
Does the 3D mammogram take longer?
Not really. I mean, because these things are associated with computing power, as computing power increases, we do everything much faster than, they did when you and I were younger.
Training, yeah, in training. So Chris and I trained a similar time. He was early in his training and I was towards the end of my training. So I'm also fascinated. I've heard women, including my wife, getting a mammogram and then getting called back for an ultrasound. Is that the normal sequence where you get the regular 2D or 3D mammogram, and then if there's something that they want another look or another perspective, they ask for the ultrasound?
Yeah. So, a couple things. Usually before that, depending on what you see. So if you see calcifications, oftentimes we'll call you back for something called spot mag and compression views. And those are basically an easy way to look at those calcifications and blow them up so you can really characterize them and see the ones that look like they might be hiding a cancer. And along with that, we almost always get an ultrasound. So that's exactly right. We'll do extra views and then we'll get an ultrasound. Rarely, we might get an MRI as well. That might be a way we can go, because all of those things can tell us individual specific details that the other modalities can't. So they all have different uses. For example, ultrasound is really good at looking at cystic structures.
Mhm.
It does really well with that. So we'll put all that together and get you what you need.
Okay, that's great. Well, we have some questions from the audience. Enough of my question. I've heard that most women who get breast cancer do not have a family history of disease. Is this true?
Yes, it is. So like we were talking about 10%, maybe more than that, are associated with family histories, but the vast majority arise spontaneously. You know, cancer is one of those things that it's kind of ubiquitous. I mean, throughout the animal kingdom, right? I mean, everything gets cancer. Your body loses its ability to have its cells divide properly. And since we have trillions of cells, it's just very common for it to arise spontaneously, even without a family history. Now, the family history portion is important because if you do have that BRCA gene, your chances of getting cancer go up tremendously. So oftentimes, if it's expressed to a significant degree, some women are offered bilateral mastectomy so that they don't, you know, but for most people, the cancer arises spontaneously without a family history.
My father has a friend whose family, he carried the BRCA gene and he's had bilateral mastectomies.
Yep.
A male friend.
Yep.
Okay, here's another question from the audience. Could you share why someone would or would not get genetic testing?
So I think that, you know, just like you talked about, like with your friend, that's a great example. So if enough people in his immediate family pop up and everybody's getting breast cancer, boom, you're going to get genetic testing because his mom had it and his dad had it and his sister, you know, if there's enough first degree relatives, those are the people that we're going to test without pause. Yeah.
Fascinating. I heard that some medical groups don't recommend routine breast self-exams. What if you were to recommend something to the audience, what would you recommend about routine breast exams?
Yeah, do your own breast exams. I think again, nobody knows your body as well as you do. So I think examining your breast and knowing if you're having discharge, knowing what's abnormal, normal, all those things can help. And I don't know how many times I've had a patient come in and say, "Well, I'm here because I felt this, and I know myself, and this wasn't there 2 months ago." And sure enough, that ends up being breast cancer. So I think self-exams are very important. I think everyone should do them.
So I know you touched on this, but we have a question from the audience. Can breast implants compromise a mammogram? Or to put another way, if someone has breast implants, what additional steps do you have to take to get a good exam?
So breast implants, just because of their nature of expanding the tissue, they tend to make the breast look more dense around the implant. So they can make a breast that was normally not dense look dense. And as we talked about, that presents some challenges. Having said that, we do special imaging sequences that basically displace the breast implant and allow us to see that tissue. So, you know, we work around it. So
Okay.
our accuracy is still fairly high, even with breast implants.
And for the women in the audience, is there a recommendation about how long you have to get your annual mammogram? Is there an age limit? Is there a time that they can look forward to not getting that exam?
Well, the ACR, that's the American College of Radiology, that's kind of radiology's governing body. They basically suggest that you continue to get mammograms throughout your life. Now, of course, that is a personal decision. If somebody has, you know, other illnesses and things that take precedent over that, and they're not able to get mammograms, I mean, that's certainly understandable. But having said that, we're going to be able to detect breast cancer no matter how old you are. And if you have a decent quality of life, I think it behooves most women to continue to get mammograms throughout life.
I really strongly encourage that. I was shocked earlier in the talk when you mentioned that 43,000 women are still dying from breast cancer every year in the United States. I personally can remember cases of women who had metastatic breast cancer that went to the brain, and the only way to stop this disease is the early screening. Catch it early.
Yeah.
Anyway, well, thank you very much, Dr. Formen.
Absolutely.
We hope this presentation was informative and helpful, and we ask you to schedule your annual screening mammogram. With screening mammograms, we can catch these cancers early before you have symptoms and when it's most treatable. Please visit nkch.org/mammo to make your appointment. And join us Wednesday, November 16, for Bone Up on Osteoporosis with Dr. James Kessel, an orthopedic surgeon with Orthopedic Health of Kansas City. Again, thank you very much for joining us and have a great afternoon.